because of virtual international conference on advancement in research and education, jointly organized by Association of Global Academicians and Researchers and Association of Indian Biologists. The topic which I will discuss on has the title Water, Sanitation and Hygiene, abbreviated as WASH, among healthcare facilities in Sokoto State. The authors are Yusuf Sarkin Gobir, Malamidi Ko, Suleiman Aliyu, Tukur, and Yusuf Yahya Mia. The presenter is Yusuf Sarkin Gobir from the Department of Biology, Shehu Shagari College of Education, Sokoto. First and foremost, we need to know what is the meaning of WASH. WASH, Water, Sanitation and Hygiene, is talking about availability of enough qualitative water. Sanitation is talking about enough and improved toilet, while hygiene is talking about enough hand washing materials, including soap, around the premises or vicinity. So, and healthcare, we know it is an environment or a place where care is given to patients or other people with health problems, ranging from the university teaching hospitals, federal medical centers, general hospitals, specialist hospitals, health posts, and so on. So, all these ones are examples of healthcare facilities. So, when we say WASH in healthcare facilities, we are talking about the water, sanitation, and hygiene as applied to healthcare facilities. We know that water is very important in life. It has diverse applications. In terms of healthcare, there are so many activities which are carried out within the healthcare facilities that requires water, such as cooking, drinking, and sanitation, cleaning, sterilization, and so on. We can see from the accumulated data that we have, despite the scarcity of data, because of poor sanitation and water-related problems, Nigeria loses 455 billion naira annually as a result of lack of accessibility to water and sanitation, as a result of premature deaths, as a result of losses to productivity, that is absent from work while seeking for health care and caring for the loved ones that are in the healthcare facilities. We also have losses due to lack of WASH from the healthcare costs as a result of malnutrition, healthcare seeking expenditure, example transportation, consultation, and so on. Because of this, the United Nations the WHO and other responsible agencies decided that there should be an entity known as WASH in healthcare to solve the problem of community WASH, to solve other problems in the healthcare. Also, because of lack of WASH, we have so much problems, especially in our young ones. For example, so many children are dying as a result of malnutrition, as a result of improper delivery in the hospitals, as a result of diarrhea and so on. And we know that the Nigeria lies within the semi-arid region, and semi-arid region, so also the Sokoto state lies within the semi-arid region. And usually countries and states that are within the semi-arid region have water problems. Because of the nature of the environment and because of policy issues. So because of these problems, as I said earlier, the WHO, United Nations and UNICEF and other responsible agencies decided to include WASH in healthcare and WASH in schools into sustainable development goals. And this is what also motivates us to carry out this kind of research to find out the level of WASH among healthcare facilities in Sokoto state. So the main objective of this study is to determine the level of water, sanitation and hygiene in Sokoto state. Materials and methods. The study design used in this research is descriptive survey and visual inspection. We use a structured questionnaire which was developed from WHO basic indicators for WASH. We use a simple random sampling to collect data using that structured questionnaire. And also, we interviewed some individuals using structured questionnaire. In the course of collection of data, 110 public healthcare facilities across the 3 senatorial zones of Sokoto state were visited using simple random sampling, data collection and management. The method we used to, after collection of data, the method we use to manage our data is thematic content analysis. We use thematic content analysis to treat the data, and we come up with descriptive parameters, that is frequency and percentages. Then result. The result of this study can be seen here on the table. Table 1 is showing the water parameters among healthcare facilities in Sokoto state, Nigeria. So we investigated the accessibility, quantity and quality of water in those affected healthcare facilities. So we investigated whether there is available or enough water. There is available water. 0.4% have no accessibility to water. In terms of quantity, whether the water is enough for the activities of those healthcare or not, we found out that 54.5%, that is the majority of those healthcare facilities, have enough water for their various activities, while the 18.1% of them do not have enough quantity of water for their various activities. In terms of quality, that is whether the water sources, 4% have no accessibility to water. In terms of quantity, whether the water is enough for the activities of those healthcare or not, we found out that 54.5%, that is the majority of those healthcare facilities, have enough water for their various activities, while the 18.1% of them do not have enough quantity of water for their various activities. In terms of quality, that is whether the water sources, that is whether the water is protected, or not. Of quality, whether the water source is protected or not. We found out that 45.5% have protected water supply, while 18.1% have no protection in their water supplies. From this result, we can see that they have the water supply in those healthcare facilities. Most of them have accessibility to water. Most of them have enough water, and most of them have a qualitative water supply. But the issue is the minor percentages are very significant. This shows that many of those healthcare facilities have their level of water supply is poor, which actions need to be taken to restore the situation. While from here we can see table 2 with the title Toilet Parameters in Public Health Care in Sokoto, Nigeria. So in terms of accessibility, 90.9% of those healthcare facilities have toilets, while 9.1% do not have toilets. In terms of quality, 36.4% of those healthcare facilities don't have qualitative toilets. Their toilets are not clean, their toilets are untidy. So this lack of neatness or cleanliness can be able to affect their patronage. People cannot feel okay to go into toilets that are not neat. So this is encouraging an open defecation behavior, which has many devastating consequences to the environment and to the health of the people. In terms of separation, that is whether there are separate toilets for females and males, separate toilets for staff and patients, and so on. We found out that only 36.4% have separate toilets for males and females, while the remaining, that is the majority, 54.5%, they are sharing their toilet. While in terms of hand washing materials, whether there is water and soap or detergent around the toilet or around the vicinity of the hospital for people to wash their hands when they contacted some contaminated materials or agents, we found out that 27.3% of them don't have hand washing materials. And most of those healthcare facilities, that's 72.7%, they don't have hand washing materials. So only 27.3% of them, that is the minority, have hand washing materials. And hand washing materials are talking about the hygiene component of wash. Table 3 is showing the worst parameters in public healthcare facilities in Sokoto State, Nigeria. So we look at whether the worst are separated into their various components. We know that there are infectious waste materials, there are non-infectious, there are highly infectious. So all those ones, there are shapes, objects, all those ones supposed to be separated into their various components. So we look at the separation. We found out that the only 100%, that is all the healthcare facilities, no any healthcare facility that have the ability to separate their waste into their various components. Method of disposal. The method of disposal we found in those healthcare facilities is, the majority of the method is, that is, which has 90% support, is through burning. While whether there is waste in the premises of those hospitals or healthcare facilities or not, we found out that 90% of those healthcare facilities, there are waste materials within their premises. We can see here from this poster, there is need for separation of waste within the healthcare facilities. As I said, there is non-infectious waste, which consists of papers, bottles, cans, food, and so on. Those ones, they are like domestic waste, so they don't need much preparation or very careful handling. While the infectious waste, such as dressing, gloves, IV fluid lines, and so on, need to be separated. We have also highly infectious waste, such as blood bag, extracted teeth, and so on. Those ones are supposed to be treated with caution. So, but in those healthcare facilities we investigated, we found out that there is no separation. So, it is possible that there is possibility of hazard to the staff, to the patient, and other people around, because there is no separation of waste. And the majority of methods they use in disposing the waste is what? Is through burning. And we know burning is, that is open burning. Burning is problematic. It increases problems to those people with respiratory problems such as asthma and so on. So, and if we can go back, we can see there is need for water, as in the healthcare facilities, for washing of hands, for cleaning, and so on, especially during this time of COVID-19 pandemic. So, the importance and impartiveness of water within the healthcare facilities cannot be overemphasized. As a result of lack of water, so many diseases can be transmitted to the staff of the hospitals, to the patient and patient relatives. And also in terms of toilet, we found out that the quality of toilets is poor. Most of the toilets, their quality is poor. Their quality is poor. And we know that toilet means sanitation. And poor sanitation or lack of sanitation has so much cost, health cost to the environment, to the patient, to other people nearby. So conclusively, we can say that in conclusion, most of those healthcare facilities, they have accessibility to toilet, they have enough toilet, they have somehow qualitative toilet, but those ones with negative parameters are very significant. So action needs to be taken. Also in terms of sanitation, we can conclude that most of those healthcare facilities have accessibility to toilet, but their quality, separation, and hygiene is poor. So care need to be taken to address the situation. Thank you for listening.